Further afield, a developing story this morning, India surpassing 2 million cases of COVID-19 infections. The country's health minister says it has recorded more than 63,000 cases in the past 24 hours. India now has the third highest number of coronavirus cases globally, sitting there behind the United States and Brazil. Well, to tell us more about this developing story this morning, we're joined by our correspondent in India, Rebecca Bundan. Rebecca, good morning. Tell us more about these numbers. Apparently recording, it's a record daily jump that's been reported by the health authorities in India.
Yes, that's right. And 2 million, crossing the 2 million mark in total for confirmed coronavirus cases is one of those, psychological figures that people do get concerned about. And it means that the number of cases in India that are confirmed have actually doubled over the past 3 weeks. And yes, India has seen more than 60,000 new confirmed coronavirus cases for the first time in a 24-hour period. That's a record daily spike. And it means that globally as well, India is now seeing the highest number of cases being confirmed in a 24-hour period, although it remains the third worst affected country globally. And these numbers just seem to be rising faster and faster. And a reason behind that is that the virus is spreading to other areas, to smaller cities. Different states are now being affected as the virus spreads out. So states like Maharashtra, which is where Mumbai is located, is still seeing very high numbers of cases. Delhi as well, Tamil Nadu. But other states are increasingly being affected, like Andhra Pradesh and Karnataka in South India. They're seeing higher and higher numbers of cases coming through. And the real concern is that as the virus actually spreads through the country, that it's reaching these smaller towns and villages where the healthcare infrastructure is much weaker than the major cities like Mumbai and Delhi. And we've seen how Mumbai and Delhi have struggled with high numbers of cases over the past few months. The hospital facilities and so on have struggled to deal with those numbers of cases. But when the virus affects smaller towns and villages, they're even weaker in terms of the hospitals and the numbers of doctors that they have. So it will be even more of a struggle for them. The government, on its part, points to the high recovery rate and the relatively low death toll in India as being positive indicators that although we're seeing high numbers in India, India does have a large population of 1.3 billion people, but it says that it's more important that the recovery rate is high and that the death toll is relatively low. And then it also says that, of course, India has increased its testing over the past few weeks and is continuing to increase testing. So that is something that's also feeding into higher numbers of cases that we're seeing being confirmed. But health experts say that India should actually be doing far more testing than it's doing on a global comparison. It's actually doing relatively less testing than many other countries.
Yeah, now, one would imagine for a country that is so vast like India, as you've mentioned, the challenge in the healthcare system with the virus now reaching rural areas, small villages, the healthcare system in some of those parts might not be existing at all. I mean, the inequalities are becoming sharper and sharper or sharply exposed, just like here in South Africa.
That's absolutely correct, and that's really what we've seen with throughout the pandemic as it's affected India. Sadly, it's really been the poor people that are the hardest hit, not just in terms of health and getting access to healthcare, which is much more difficult for them. They can't necessarily afford it and often only have access to government hospitals, but also economically as well, because the coronavirus and the subsequent lockdowns that came into effect in the country because of the pandemic have really hit migrant labourers who moved back to their hometowns very hard, left without work, poor people in the slums. It's been really challenging for them, and many of them are still without incomes because of the continued effect of the pandemic and the fact that many businesses still remain shut and there are lockdowns still in place across the country, and many states have decided to enforce stricter lockdowns, although the Indian government has allowed a lot of relaxations on its part, but it's up to the individual states to then decide which of those it allows the states to actually go ahead with. So, I mean, there has been a certain amount of opening up of the economies, but there's also criticism around that because, for example, this week Mumbai has allowed its shopping malls to open, but numbers of cases in Mumbai, although they're off their peaks in the city, are still very, very high, and people are concerned that the virus will spread as the economy continues to open up.
Thank you very much, Rebecca Bandun there from Mumbai, our correspondent in India, on that developing international story this morning with